Citius, Altius, Fortius, faster, higher, stronger.
Elite sport is different to a lot of areas of medicine.
But if you want to manage risk, these are the key things.
Managers now are starting to adapt, they're starting to listen to doctors, to physios. There's more about the place.
Medically though, it's definitely better.
Yeah.
It's safer.
Yeah.
It's a better environment for a professional footballer to be around. The physio said, "Where does it hurt?" And I said, "Everywhere." So he threw the bucket of water all over me, rubbed the sponge in my face. He said, "You're okay, go on."
The lectures we have within FISIC are all short. They're 10-minute lectures, but there may be 8 or 10 of those within a session.
And each one of us learns something. It doesn't matter how experienced you are, you pick up something from someone else from a different discipline and think, oh, I didn't realise that, I think I'll use that.
The best care is from lots of clever people putting their heads together and working out what is the best for that patient.
Shifts, so you get...
If you're going to go for evidence.
I need to take advice from you.
A very open community, sports medicine. In fact, the rest of medicine can learn a lot from it.
You can hear from a radiologist, you can hear from a physiotherapist, a physician and a surgeon, all within the same conversation, so you really get a broader understanding.
Carry on doing it with his
Membership figures of FIFA is over 200 million registered players.
What we're doing now is probably more fine-tuning, and we're trying to adapt and customise the treatment, particularly the surgical treatment, to that individual.
If you understand how it works normally, then you can work out why it goes wrong and therefore what you can do to correct it.
We're talking about the theories of why we may do surgery, but then how we can actually get the whole patient back to play.
We were brave enough to introduce 2 live surgeries, which can be risky. It's very stressful for the surgeons, but they went off fantastically, and I think it generated a lot of interest.
It adds another dimension to this year's meeting.
We're going to see an ankle arthroscopy with James Calder.
We're now obviously in the ankle joint. There's a bit of hemosiderin deposit. Thanks, so I can just get that through the skin.
How would you know?
The key is that
Hip injuries, for example, with groin pain, might actually be better together.
Some great level of debate actually, some good challenge from the floor, and I like the way this meeting's set up.
There have been really good question and answer sessions, really challenging back at some of the speakers, but also allowing new information to come out through those question and answers.
Good points about how to rehabilitate some of the more difficult injuries.
Some of us will be more surgical in their approach, and some of us will try and be more conservative, and it's interesting sort of discussing it, because there isn't at this point a specific right or wrong.
Anyway. I've been a physio for over 30 years. I've learned quite a lot today and yesterday.
Realise that there isn't a perfect way, and we're all trying to develop the best possible treatment for our patients.
And making sure that we look after them for the whole of their career and beyond their career in sport.
FISIC will remain a big part of Fortius, and we are already beginning to think and plan about 2019.